Marhaba, and welcome to today's episode of The Doc Is In. My name is Josephine Kabambi, and I'll be your host for today's episode, brought to you by the Cancer Institute at the Fatima bint Mubarak Center at Cleveland Clinic, Abu Dhabi. Joining me today is Dr. Saima Khan, a UK-trained family physician with over 18 years of experience in family medicine as well as preventative medicine. Today, we'll be discussing the important but often overlooked topic of survivorship, from the unique challenges faced by this patient population to the importance of ongoing care. Dr. Saima Khan will help shed light on what it takes to not only survive but also thrive after cancer treatment. Dr. Saima, thank you so much for joining us today.
Thank you, Josephine, for giving me the opportunity to come and speak to you today. For our viewers, a cancer survivor is someone who has been diagnosed of cancer, no matter where they are in their journey. However, in our clinic, which is a part of the innovative oncology-focused longevity medicine program at Cleveland Clinic Abu Dhabi, we typically start seeing these patients 6 months after their diagnosis, so once they have completed their active treatment.
And can you tell us a little bit more about why it's important to have a specific field focus on survivorship?
So survivorship is a neglected phase of cancer care trajectory. And, with all the new changes in the screening practices, people are getting mammograms more regularly. Just to give you an example, or pap smears, improvement in the treatment protocols, and also the advancements in the treatment, including immunotherapies. There has been an increase in the number of cancer survivors. By 2029, there is an expected 30% rise in the number of cancer survivors. And 50% of these will be above the age of 50 years. So you can see this is a unique population with its own unique needs. And if you think of it, these needs can vary between the two individuals. So depending on the type of cancer they had, the stage of cancer they had, and even the kind of treatment modalities they received. And it can vary within the individual depending on where they are in their journey. What we find is that when patients are completing their active treatment, some just feel that it's almost like a sprint across a finish line. But for many, it's almost like they are training for a marathon they never signed up for. So it has emotional pitfalls, it has surprise hurdles, and new normals at every mile marker. And many of them feel that they have not been handed the roadmap to the road ahead. So one of the purpose of this clinic is also to ensure that we facilitate a smooth transition of care for these people who sometimes feel a little bit lost after the active treatment is over.
Okay. So I'd like to take a second to kind of focus on that word survivor. Recently, the Fatima bint Mubarak Center switched from the term survivorship to longevity medicine. Can you help us understand why that transition was made?
So this change reflects a more broader, more proactive model of care. And this was not a top-down initiative, but actually was guided directly by the feedback from a patient and family advisory committee. Patients consistently express discomfort with the word survivor, while longevity medicine was seen as optimistic, empowering, and more in line with our aim to help our patients thrive, not just survive.
And we're seeing more and more clinics pop up in this longevity medicine space, not so much in oncology, but can you help us understand what makes our program unique?
So as you said, Josephine, there are not many oncology-focused longevity medicine programs in the region. And we're not just another clinic, we are a one-stop ecosystem. We are very lucky and very fortunate at Fatima bint Mubarak Center that under one roof, we have a physician-led service where we have board-certified oncologists, lifestyle physicians, high-risk cancer specialist, genetic counselor, obesity specialist, along with oncology nutritionist. We have psychologists, pelvic floor rehab specialist, along with exercise coaches and alternative therapies, including Reiki and sound healing. So our care is more longitudinal, more proactive, and holistic, ensuring that we address physical, emotional, spiritual, and social needs of our patients.
That's great. Thank you for helping us better understand the longevity medicine program. Could you help us understand more of what the goals are of this clinic?
So, the premise of this clinic is to change patient care from a model of illness to a model of wellness. There are 4 key areas we focus on in our clinic. The first one is surveillance or screening for the recurrence of cancer and also for second primary cancers. And at the hospital in our clinic, we follow international guidelines and disease-specific algorithms to ensure that our patients receive a systematic and evidence-based approach to screening. Some patients, depending on their personalized risk assessment, may need additional screening compared to general population. So just to give you an example, some patients, instead of just needing an annual mammogram, may need an MRI of their breast as well, based on their assessment. The second concern area we focus on is addressing the modifiable risk factors. And through a multidisciplinary team approach, we ensure that we help our patients optimize their diet, their physical activity, their sleep, address any risky behavior like smoking and alcohol, because we know by introducing these lifestyle interventions, it can have a positive impact in terms of reduction of the chances of recurrence of cancer, prevent new cancers, and also in general decrease the cardiometabolic disease burden. The third area we focus on is the long-term and late effects of the cancer and its treatment. Lastly, we conduct a personalized risk assessment for our patients, and based on that assessment, some of the patients may need to be referred to high-risk cancer clinic and genetic counselor. So when patients come to us in the clinic, each patient receives a personalized care plan, and this helps us to have a more smoother, coordinated care amongst all institutes at Cleveland Clinic Abu Dhabi.
Okay. And can you talk more about some of the symptoms or the major concerns that patients will come to your clinic for?
So each patient has their own unique needs. Some of the common concerns patients come with are they are feeling tired all the time, or problems with sleeping, or they're finding weight management a concern. Some patients come with neuropathy or cognitive decline, which we call chemo brain, or they may have concerns regarding their bowel and bladder incontinence. So when the patients come to us, we do a detailed, targeted assessment of their symptoms and create, through a multidisciplinary team approach, a plan which is personalized and specific for the patient. So just to give you an example, if somebody is coming to us with lymphedema, they may need input from our lymphedema service. We have physiotherapists who can help them, and also occupational therapists. Others who are receiving treatment for cancers like, say, breast cancer or ovarian cancer or prostate cancer, due to the treatment, they may have hot flushes and night sweats, and we have specialized menopause and andropause clinics to help address some of those symptoms. Others, they may have bowel or bladder incontinence or sexual dysfunction, especially those who had abdominal or pelvic cancer due to the cancer cells or due to the treatment. And by getting our specialized pelvic floor physiotherapist involved sooner, we can actually make a really meaningful impact on the quality of the life. So when the patients come to us, we share with them a symptom inventory. Now, this is a list of some common symptoms and concerns our patients come with. And patients actually can put in the intensity of the symptoms from, say, a scale of 0 to 10. And we look at this symptom inventory at every follow-up, because this, in a way, I feel gives us an objective assessment, not just for us, but actually for our patients as well, to see how our interventions are impacting their symptoms. Also, When our patients come to us in the clinic, remember, for months before they transition to our clinic, patients and their physicians' focus is on treatment of their cancer. So we use this opportunity to screen them for their blood pressure, their visceral fat, their blood sugars, their cholesterol. In addition, some patients may also need bone scan, what we call DEXA scan, to look at the bone health. Some patients may need periodic ultrasounds of their heart, echocardiogram, depending on the treatment they had or depending on the symptoms they have. And some may need CT calcium score to look at the buildup of calcium and plaques in the blood vessels of their heart.
Yeah, I mean, it's really nice to hear that you create such an individualized approach that really responds to the needs of each individual patient. So that's nice. I mean, one symptom that I heard you talking about was weight. Can you help us understand how important weight management is?
So, weight is crucial. I would say, Josephine, it is the risk factor of greatest concern. Because if you look at the most common cause of death in cancer survivors, it is not actually the cancer, but it's actually the heart disease, which is associated with cardiometabolic dysfunction and obesity. Based on Sears data, 20% of the cancer deaths in women and 14% of the cancer deaths in men is associated with obesity. And currently there are at least 12 cancers which are statistically associated with cancer, including the breast cancer, the ovarian cancer, the endometrial cancer, colon cancer, just to name a few. And there's a strong body of evidence out there that the excess body weight is associated with less favorable outcome for many cancers. And because of this, our program tackles this head-on with our board-certified obesity specialists who, along with the nutritionist and exercise coach, are able to empower our patients with the interventions to address this.
Okay. And can we talk a bit more about sleep? Sleep is obviously important for everyone, but especially, someone who's going through cancer. What kind of support do you provide for patients who might be suffering from insomnia?
That's such a great question, Josephine, because as you said, insomnia is 4 times more common in cancer survivors as compared to general population. So when people present to us, we do a detailed assessment to understand what is contributing towards their insomnia. We evaluate them for underlying anxiety and depression. We see if they need specialized assessment in our sleep clinic with a sleep study to see if they have sleep apnea or restless legs. We also see if there are symptoms like neuropathy due to the treatment they have received, which is contributing towards their insomnia. And as I said earlier, some patients with breast and ovarian, and prostate cancer, due to the treatment, they're having hot flushes and night sweats, and that all can impact their quality and quantity of sleep as well. We also look into things like the type and time of food, or caffeinated drinks, or the type and time of exercise they're doing. Just to give you an example, if someone is eating a heavy or large or spicy meal just before bedtime, that increases the blood flow to our gut, and that can be metabolically really active process, which will increase your body temperature, and people will find it hard to go to sleep. Also, if you are sensitive to coffee, half-life of coffee actually 7 hours.
That's very long.
And if you're having coffee, say at 5:30, and your bedtime is 10, some people may find hard to go to sleep as well. We also have a psychologist who can provide cognitive behavioral therapy for insomnia, which is the gold standard for insomnia. So we use different modalities to help empower our patients to optimize the quality and quantity of their sleep.
Okay. And I want to shift a little bit to talk about lifestyle. How important is lifestyle to either getting cancer or having cancer come back after you've been treated?
So, research has shown that 15% of the cancers are due to hereditary mutations, whilst 85% are driven by environmental and behavioral factors.
Okay.
So, diet, physical activity, the kind of stress your body has been exposed to physically and mentally, the kind of social connections you have around you, so positive social connections, or the sleep quality, or smoking, alcohol, all of these things have a huge impact. We know for a fact that epigenetics cannot change a genetic code, but actually it changes the way it's read. So, just to give you an example, it's almost like you have a recipe in a cookbook, right? And but for that to be translated into a dish on your table, you need to have a cook who's motivated enough to make it.
Right.
You need the right ingredients in your pantry, and you would also need the right temperature in your oven, right? So, a little while ago, I was reading a book called A Metabolic Approach to Cancer, and it's a really interesting read because what the author said was the positive lifestyle interventions actually impact our immunity,
Okay.
they impact our gut microbiome, and they make our body terrain less conducive for the cancer seeds to grow.
Okay.
Yeah.
Wow. Okay. Well, my final question has to do with fatigue. It's something that a lot of survivors face. Can you talk a bit more about how you manage fatigue for cancer survivors?
So this is, I would say, one of the commonest concern our patients present when they come to our clinic. The thing about cancer-related fatigue is it is complex, it is persistent, it's not related to the activity people are doing, and it can be extremely disruptive for our patients.
Right.
So when they come to our clinic, we take a detailed history, we do a detailed physical examination, and some patients may need lab work or imaging, heart ultrasounds based on that assessment. We rule out underlying causes like anemia or nutritional deficiencies, problems with the thyroid, if they have any kidney dysfunction, if their heart isn't working as well as you would like it to, if they have underlying anxiety or depression, if they have sleeping disorder, if they are just dehydrated and not drinking enough water because of the treatment they've received or how they're feeling. So there is lots of things we look into to ensure that there's nothing else we need to address. Our lifestyle physicians also help our patients address their diet and encourage them to have what we call a mitochondrial diet.
Okay.
Yeah, so I don't know whether you recall this mitochondria are little powerhouses.
yes,
Remember, like
yes.
in science and in
Wow,
our
back in
school.
the day, exactly.
So these are powerhouses in
Yeah.
our cells, and by giving a diet or by signposting our patients towards a mitochondrial diet, that can also help improve the symptoms. Some patients may require supplements to help with their tiredness, and in very few cases, if all the lifestyle interventions have failed and they have tried to structure their day, they have tried to do energy conservation, they have tried to pace, and nothing else is working, then sometimes some patients may also need medications.
Okay. Okay.
Yeah.
Well, Dr. Saima, thank you so much for being with us here today.
It's my pleasure.
I've certainly learned a lot more about longevity medicine and some of the unique needs that cancer patients need both during treatment and after. So thank you. And to our viewers back home, if you know anyone who could be in need of this service or could benefit from learning more about some of our longevity medicine offerings, please share this podcast with them, and definitely make sure to join us at the next episode of The Doc Is In.